Alright, so we're going to be starting this with some range of motion assessments. And in the upper extremity, we're going to be testing shoulder external rotation. In the lower extremity, we're going to be doing hip abduction. And in the spine, we're going to be testing thoracolumbar side bending. So to start with the upper extremity, we're going to be doing shoulder external rotation. So what you're going to want to do is you're going to have your partner or your patient lying in a supine position. And you're going to want to put a towel under their shoulder or just the humerus to make sure the acromion is level with the humerus. And then you're going to want to have them just passively externally rotate. So, and along with that, you're going to want to have them be their shoulder in 90 degrees abduction and their elbow in 90 degrees flexion. So to show you that, she'll come out here in 90 degrees abduction and 90 degrees elbow flexion. I'm going to put the towel under the shoulder so that that's level. Now, the axis of rotation is going to be at the olecranon process, and then the stationary arm is going to be perpendicular to the ground, and the mobile arm is going to be along the ulna lined up with the styloid process. So, lining up with those landmarks, she's going to go ahead and passively externally rotate. And with that lined up, and normal range of motion is 90 degrees, and for her, she had about 94 degrees. And that is shoulder external rotation. And this motion occurs in the transverse plane along the longitudinal axis. And the next thing we'll be doing is hip abduction, and this motion occurs in the frontal plane along the anterior-posterior axis. So in hip abduction, what you want to do is have your partner or patient lying in a supine position. You want to have their legs straight and extended and the hip in a neutral position. You want to have the axis of rotation along the anterior superior iliac spine, which is right about here, and you're going to want to have the stationary arm in a horizontal line across connecting the two ASISs, and you're going to have the mobile arm running down the midline of the femur. So I'm going to put the axis of rotation along the ASIS right here. The mobile arm, the stationary arm is going to connect, and the mobile arm is going to go down the femur. And have them abduct. Down the midline. And there we go. Now, normal range of motion for hip abduction is 45 degrees. And as we can see here, it was about 52 degrees. And that is hip abduction. And the last range of motion we're going to be doing is thoracolumbar side bending. This motion occurs in the frontal plane along the anterior-posterior axis. So what you're going to want to do is you're going to want to have your partner or your patient standing. You're going to want to make sure their feet are shoulder width apart and they're just in a nice neutral position. And you're going to want to have them bring their hand to their side. And you're going to take the distal phalanx of the third digit and you're going to mark where that is. And then you're going to have them side bend and make sure they don't flex or extend the spine. You're going to mark that new position and have them return to normal. Normal range of motion for thoracolumbar side bending is 21 centimeters. And as we can see here, we had about 8 inches, which is about 20 centimeters. And that is thoracolumbar side bending. Alright, now we're going to be moving on to manual muscle testing. For the upper extremity, we're going to be doing shoulder external rotation. For the lower extremity, we're going to be testing the tibialis anterior. And for the spine, we're going to be testing the quadratus lumborum. So, starting with the quadratus lumborum, the origin of that muscle is the lumbar transverse processes 1 through 4, and the posterior 1/3 of the iliac crest, and it inserts on the posterior surface or the inferior surface of the 12th rib. And to manual muscle test the QL, you're going to want to have your partner or patient lying supine, and just going to want to have them be in a neutral position before you start. And what you're going to want to have them do is you're going to have them first, before you test, just hip hike themselves to make sure they can complete the motion. So go ahead and hip hike. So now that she's in that position, you're going to grab the ankle and you're going to pull down opposing their motion. Okay, so I would give that a 4+, and that is how you manually muscle test the QL, and that motion occurs in the frontal plane along the anterior posterior axis. So next muscle we'll be testing is the tibialis anterior, and this muscle, the origin is the superior tibia, and it inserts on the medial cuneiform and the base of the first metatarsal. The action of this muscle is dorsiflexion and inversion, in which dorsiflexion occurs in the sagittal plane along the medial lateral axis. So what you're going to do to test this muscle is you want to have your patient or your partner just sitting in a neutral position. Ideally, you would want to be on a mat table, but because of this, we're just going to do it on chairs. And you're going to want to have them bring their leg up and rest it on your knee. And in order to test this, you're going to have them put it in a dorsiflect position as well as inverted. And you're going to take your hand, one hand here and one hand stabilize here, and then you're going to want to pull in the opposite direction, like so. I would give that a 4, and that is how you test the tibialis anterior. Alright, the last manual muscle test we'll be doing is the infraspinatus and the teres minor. These are part of the rotator cuff, and they perform external rotation in the transverse plane along the longitudinal axis. Now, the origin of the teres minor is the lateral inferior part of the scapula, border of the scapula, and the origin of the infraspinatus is the infraspinous fascia, and they both insert on the greater tubercle of the humerus. So, what you're going to want to do is you're going to want to have your patient or your partner lying in a prone position. You're going to want to make sure their head is faced towards the testing arm, and you're going to want to have them make sure the humerus is 90 degrees abducted, and you're going to want to have their elbow in 90 degrees of flexion. So right here, 90 degrees abduction, 90 degrees of flexion at the elbow. And first you're going to want to have them passively bring their arm up into external rotation. So now you know they can complete the motion against gravity. Next, you're going to want to stabilize right here with one hand, and with the other, you're going to have them push into your arm in external rotation. Go ahead. There you go. And I would give that a 4. And that's how you test external rotation of the teres minor and infraspinatus.